Uh, how did you find out that you had a personality disorder? If someone invited you to social events, then you wouldn't go? Or just thank you so much for doing this. It's amazing. I asked a bunch of people and no one wanted to, so it was amazing that you want to join. Thank you. It means a lot.
Yeah, my honor. My honor. No problem.
Okay, so the first question I want to ask was, how did you find out that you had a personality disorder?
So the way that I found out was when I was in grad school. So after undergraduate school, I went into graduate school for counseling psychology to become a therapist. So we had a class. It's a diagnosing class called psychopathology, and you learn all about mental health disorders in that class. So when we got to the personality disorder section, that's when I actually found out that I had avoidant personality disorder because in that class, you learn what all the criteria and symptoms are. So
Mm.
looking through the symptoms, can you hear me okay?
Yeah, it just glitched. I don't know what happened, but it's working now, I think.
Okay. Um, I started looking through all the criteria of avoidant personality disorder, and I said to myself, I meet most of these criteria. And so that's when I found out that I had that disorder. It was when I was in graduate school.
But and what did you do then when you figured it out? Did you go to get a diagnosis, or did you just, yeah, or didn't you do that? What did you do after you figured
I
out?
think I was I think I was just at that time I didn't go get a
Yeah,
diagnosis. I
yeah.
didn't go see therapy because I really didn't know what the next steps were because it wasn't there were no established methods of okay, you have this, now you go see this person.
Mm.
So really I was just relieved to just know that there was something that explained why I was behaving the way that I was. I was just happy to know that there was something out there that I can put a name to. This is why you do what you do.
Yeah, I understand. Totally understand. And
hmm
do you have some examples on the symptoms you noticed once you first realized you had it?
Yeah. So a lot of the symptoms are just avoiding like social contact. I would make sure that I wouldn't put myself in positions where, I would have to talk to people a lot because I would get a lot of anxiety about that. A lot of self-esteem issues. So symptoms of, having low self-esteem, I really noticed a lot of that as well. So those were the main things. It's just when people, it was almost like I had an allergy to people. So anytime that I would be around people, I would notice my anxiety would get pretty high. And so that was probably one of the main symptoms I noticed about it.
So is it like, for example, if someone invited you to social events, then you wouldn't go, or would you go to them, but you would try not to talk to people, for example? Or how do you deal with being invited to social events?
hmm
Yeah.
So if I had a safe person, like a family member or a really, really close friend, then I might go to the event, but I would stay around that person the entire time. I wouldn't really talk to other people. I would stay close to that safe person that
Mm.
I know. And if there were no safe people, then I would probably not go because I would have, a lot of thoughts in my head just about feeling weird or awkward or out of place. Also, maybe they don't really want me there, so those kind of thoughts would really cause me probably not to go if I didn't have that safe person.
Okay, I understand. Thank you. And when did you say that you realized you had it? What grade was that? How old were you?
I was well into my adult years when I figured out that I had it.
Okay.
So in grad school, I think I was about 28 or 29
Okay.
when I realized that I had avoidant personality disorder.
Great. And yeah, you had avoidant personality disorder. And do you know what the cause of your personality disorder is? Why you got it?
So I have a lot of ideas. So as an anxiety specialist, which is what I do, I've got a little bit more insight. into what might cause anxiety issues and anxiety related personality disorders. So the general consensus is that it's a combination of things that can cause someone to have avoidant personality disorder. And ultimately, we don't know for sure, but we've got some good guesses. So for me, definitely, and with a lot of people, it first starts with your temperament. So when we're born, we all have these like temperament traits where some kids are more outgoing, some kids are more, quiet, some kids are super like hyper and aggressive, like in a good way, they just have a lot of energy. So when I was a kid, I had a temperament of just being very quiet. So also I was an only child. So I spent a lot of time by myself. So when you combine a temperament of being quiet and then also spending time by yourself, you have a lot of time to get in your head just about your thoughts. Also, I had a lot of social experiences that weren't too pleasant for me. So I would start to avoid those social experiences with people because I didn't want to have an unpleasant experience again. So I would say a combination of temperament plus being an only child, plus having maybe lots of negative social experiences caused me to start to have negative thoughts about socializing. And then that started the process of avoiding those experiences. And then over time, that kind of creates, the avoidant personality.
I understand. Okay, and what kind of symptoms do you experience today, if you have any symptoms you experience?
Yeah, so my symptoms today are, I would call them, so the technical term is episodic. I have what are called basically flare-up symptoms. I don't experience a consistent presence of avoidant personality disorder, but I do have periods where I have strong symptoms of it. And the symptoms that I experience today are just the thoughts that I can't get myself out of sometimes. So we can call that like the stories that we tell ourselves. So if someone politely declines something or someone doesn't want to do something, I might start telling myself a story that, they really don't want to be around me, or, I'm not worthy of their attention, or, they had better things to do. And sometimes it's really hard to get myself out of that story, right? To the point where that story just takes over my mind, and then I will start to pull back and avoid. So those are the main symptoms that I have, is that, my mind, so things like rejection, if I perceive that I've been rejected, or maybe if there's an event and I perceive that maybe people at the event might not want me to be there, or maybe I don't belong, sometimes it's hard for me to get myself out of those stories. So those would be my main symptoms currently.
Yeah, I understand. And how does avoidant personality disorder affect your daily life? And if you have some examples you could give?
Yeah, absolutely. So daily examples, just interactions, like even with my family, daily interactions. Sometimes I'll wonder if like my family still likes me, right? And so maybe I'll try and read their nonverbal behavior to see if like they still like me. So that's one way it can affect my daily life. If I'm going out, let's say to get groceries or get coffee, sometimes I'll wonder if people are looking at me and judging me, and if I'm doing something weird or saying something weird or coming off as weird. And if I have to interact with people, like at the grocery store or coffee shop, sometimes I won't know what to say or how to, start a conversation or do small talk. So, but luckily I've got skills to help me to do that. But typically talking to people, I would call it an event, right? So typically talking to people is an event for me because that doesn't socializing doesn't come naturally to me. So it can be difficult just to interact with people throughout the day.
Mm, I understand. And yeah, how does that affect your job? If it doesn't, aren't you, what was your job again? Is it's a
So
doctor?
yes, so
Yeah.
I'm a mental health doctor and I specialize in treating anxiety disorders
Mm.
and anxiety related disorders, so including avoidant personality disorder. And the way that it affects my work is just I'm always anxious around my clients, right? But I have skills to manage that though. But avoidant personality does affect the way that I feel around my clients. Sometimes I, feel like my clients might not like me, or do they think I'm doing a good job? So those things kind of pop up in my head.
Yeah, I understand. Okay, and mm, what treatments have you had, if you've had any? And I also wondered, is it treatable? Because on one source on the internet, I saw it was not, but
Mhm.
yeah.
Yeah. So technically, there is no established treatment for it. There's no, gold standard treatment of this treatment is super effective for avoidant personality disorder. And the main reason is it is an under-researched personality disorder. And I hate to put it this way, but it's just not popular enough to research and get a lot of awareness and funding towards treatments for it. Now, a lot of people do have it. It's very common, but for some reason, it's just a really under-researched issue. And I think because there's that social stigma to it, it's kind of like people, maybe think that we should get over it, right? It's something that we can get over very quickly. So, I don't know all the full reasons why it's under-researched. I love researching it myself. But in terms of, the prognosis of it and, can you recover from it? It's a hard thing to cure and get over, because once something becomes a part of your personality, that's really hard to change. So personalities are really hard to change. So if you develop an avoidant personality disorder, then that's, really how your brain likes to operate now, that's why it's so difficult to change that personality disorder. You really have to become an entirely new person to completely get rid of the avoidant personality disorder. So that's why I still have, a lot of traits of it, because it has become a part of my personality. Treatments that I use for myself. So I have never gone to a therapist to get treatment. Once I started specializing in anxiety, I just started treating myself. And cognitive behavioral therapy, advanced forms of that are excellent for my avoidant personality disorder. So specifically, it's not necessarily, identifying my thoughts and working with my thoughts and challenging my thoughts. What it really is just being mindful of how I want to behave and really questioning what are the motives of that behavior, and then trying to change that behavior a little bit in the moment. That really helps. And then also identifying, what thoughts are causing these behaviors, and then how can I look at those thoughts a little bit differently. And CBT is a very complicated, when it's done good and right, it's a very complicated therapy to deliver and understand. But basically, what it aims to do is it wants you to just start behaving a little bit differently than how you typically would, so that you can get new experiences that challenge that personality.
Sounds good. Um, and have you seen any improvements for yourself?
Oh, absolutely. Absolutely. The biggest improvements for myself are that the avoidant personality, it doesn't control me every day 24/7. So I can actually do things like this interview, or, call a friend or go to the store, because I consistently in the past have chosen to behave differently rather than avoid. Now, there's a whole lot of skills in CBT that help you to actually behave differently, because that's really hard. If you've been avoiding for a long time, behaving differently seems impossible. So you need a lot of skills to get you to that point where you can behave differently. But the benefits that, I've seen in my life are that I can do things where in the past I would have typically avoided them. Now, every now and then, maybe once or twice a month, or, maybe not even that frequent, I will just outright avoid things because it is still a part of my personality. So I call those moments like flare up moments.
And how do people react when you tell them you have APD? Do they have any prejudice against disorders? or
Yep. So the people that I tell are my clients who actually have avoidant personality disorder because it's so important to normalize that for them. First, they probably think that there is something wrong with them because of the fact that they didn't know that this disorder existed. So once they learn that the disorder exists, that's a relief for them. But now they feel like they have this weird disorder that no one has. And so when I tell them I have it as well, it's a huge relief for them because now we can normalize avoidant personality disorder. Hey, it's not this rare, weird disorder. My therapist has it. There's a lot of people online and groups that have it. So people are really relieved when they hear that, I have it. And I only tell my clients. I don't really tell, other people, acquaintances or friends, just because it's really not necessary. I'm able to cope around them pretty well.
yeah, of course, I understand. Um, yeah, and you actually answered that question. How does avoidant personality disorder affect you socially?
Mhm.
I think. But did you say you got a diagnosis for the personality disorder?
So I was competent enough to self-diagnose. So as a therapist, I realized that I met all those symptoms. In grad school is when I figured out, and then
Mm.
when I finished grad school and became a therapist, I was competent enough to self-diagnose myself with avoidant personality disorder. But a lot of therapists really don't understand avoidant personality disorder or how to treat it because it's not something that people run to specialize in, right? So you'll have a lot of therapists who are seeing a client with avoidant personality disorder, and they may actually not know that that's what the client has, or they may just diagnose it as social anxiety disorder,
Yeah,
which
that's
are
the
much
issue. Yeah.
different. Yeah. Have you ever
Yeah.
wondered about the differences between those?
Yeah, if you know the differences, you could tell.
Yeah, so social anxiety and avoidant personality disorder are similar, but they're way more different than similar. So social anxiety it's a performance anxiety disorder, right? So think of if you ever want to take a test or you've played a sport and you feel that anxiety before a test or playing a sport, that's performance anxiety.
Mm.
So social anxiety is like social performance anxiety. And people with social anxiety, they fear being humiliated or embarrassed, things like that. They don't want to make a social mistake. So, because they're so concerned about being judged for making a social mistake, they kind of draw back in social situations. It's not that they're necessarily afraid to socialize, they just don't want to make a mistake while they're socializing. So, they're just a little bit more reserved. They
Mm.
typically don't avoid social interactions either because they do thoroughly enjoy them. They just don't want to be the center of attention that could cause them to make a mistake. Avoidant personality disorder, it's all those things with social anxiety disorder, but with avoidant personality disorder, that is primarily comprised by this, I would call like a crushing sense of inferiority. So you actually don't feel like the people that you would socialize with are on your level or that they would like you. You feel inferior to them. So not only do you fear making mistakes around them, you also fear being rejected by them. Like kind of like they don't want you to be a part of their group.
Mm.
So people with social anxiety do not typically have inferiority issues. They feel like they're just as equal as their peers. But people with avoidant personality disorder, they feel very inferior to their peers. So that's why they will avoid those social interactions altogether. Whereas someone with social anxiety, they might not avoid it. Most likely they won't avoid it. They're just not going to try to be the center of attention when they're in that social interaction. So those would be the main two differences of social anxiety and avoidant personality.
Okay, I understand. Thank you for
Mhm.
explaining.